Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Our guest today is Dr. Barbara Hutchinson. She's with the Anne Arundel Medical Center. She's a cardiologist, and today we're talking about heart health. She's also president of the Association of Black Cardiologists. Thank you so much for joining us today.
Thank you for having me.
Today we're going to talk about heart disease and how it disproportionately affects the African American community. I want to start by you defining heart disease. What is heart disease? What does it encompass?
When we talk about heart disease, it encompasses several things. Because when you think of the heart does several things. The heart pumps, so one of the things that can happen is the arteries that feed the heart that pumps could be clogged, and that can lead to a heart attack. Secondly, there are valves in the heart. Some of those valves may not work, so you could have valvular heart disease. Thirdly, you can be born with several congenital problems, so you could have congenital heart disease. And also you could have electrical problems in the heart where the heart doesn't fire the way that it should, and that results in arrhythmias. So usually when we talk about heart disease, it encompasses all those things, but invariably the one that we're referring to is coronary artery disease, which implies that there's a blockage in one of the arteries feeding the heart.
What's the difference between a heart attack and a stroke?
Very good question. A heart attack results when you have inadequate blood flow that feeds the heart. So there's an artery going to the heart that's clogged that results in a heart attack. When you talk about a stroke involves the brain. So it can be an artery in the brain that is clogged too, or ruptures. So there could be a plaque or there could be a blood clot in the brain. So a heart attack is from the heart, and a stroke results from injury to the brain.
Which one is more deadly?
They actually can both be deadly in the fact that they can both result in you dying. Because if you have a heart attack and you do not get attention immediately, the heart stops, and that can result in death. Similarly, if you have injury to the brain, whether it's from high blood pressure resulting in blood clot or resulting in a bleed in the brain, that too can result in you dying because you can succumb to death that way too.
Also, a disproportionate number of African Americans suffer from high blood pressure.
Yes.
And high blood pressure can lead to strokes or heart attacks.
Yes.
So let's talk a little bit about what causes high blood pressure, and it's very treatable.
High blood pressure is treatable, and when we talk about heart disease, like I said, coronary artery disease, when you look at the risk factors that can predispose to that, it includes things like high blood pressure, it includes diabetes, it includes high cholesterol, it includes tobacco, it includes inactivity. And so in African Americans, we tend to have a high prevalence of hypertension or high blood pressure that can predispose to heart disease.
Is this genetic?
Heart disease can be genetic, but in this case, I think of it in terms of environmental factors that are the same. But I would say that several of the risk factors for heart disease can be impacted or can be changed. For example, we may not be able to change your sex, although now they can do surgery to do that. You may not be able to change your age. You may not be able to give away your parents, mom or dad, where your genetics come from. But if you have high blood pressure, you can impact that by pulling all the stops out. And I call these stops, first of all, if you know it runs in the family, you first start by watching your salt, because African Americans tend to be very salt sensitive. That can lead to high blood pressure.
Is it salt sensitive, or is that we put too much salt on it, or no matter how much salt, we are just more sensitive?
It doesn't matter how much salt, we are more sensitive. But in addition to that, we do put more salt.
Okay.
So it's both. And really watching the salt, because that can decrease the blood pressure. Exercise. And just sometimes I think we think, especially when we are young, we think we are indispensable. or we think we have time, and not realizing that with time, if we don't do anything about it, it just gets worse.
Are there symptoms involved? Like, let's just say if you did have a heart attack or stroke, how much in advance do you know? Are there signs that you should be looking for? What should you look for?
Well, there are several signs that one can have that can suggest that something may be wrong with the heart. The one that we're all familiar with is chest pain. Pain in the chest. I like to say symptoms that you have when you exert yourself that resolve when you stop or when you rest. And I would take this opportunity to say that it's very important to recognize, especially as a woman, you may have impending signs that are different. And that's why often it's missed in women, because women may never have chest pain, but they may complain of shortness of breath. They may complain of just overwhelming fatigue. They may complain of jaw discomfort, shoulder discomfort, even abdominal discomfort, nausea. That can be related to the heart. So I often tell women, if you have a symptom when you are exercising, when you're walking in the grocery, walking around the house, and you notice it goes away when you stop, it's important to bring that to the attention of your physician.
Have doctors now become more aware of that? Because years ago, a woman would come in and she'd present differently than a man, and she would be sent home. So have doctors been made more aware of the differences in the way men present opposed to women?
I think doctors are aware, but there's still some doctors that are not aware, because based on our statistics, the fact that it's still the leading cause of death in women and men, and still we have women that are presenting late with significant heart disease. And when you go back and check in their history, they had been telling someone for years, I just feel so tired. And it's always attributed to your anemia, or you're just not getting enough exercise, or the biggest one is because you're obese. And I think it's very important that we shouldn't allow these things to prevent us from doing all the things that we should do to ensure that is in fact not heart disease that these women have.
You just mentioned obesity, which is the mission of Sisters for Fitness, the nonprofit organization that's associated with this show. How much of a factor is obesity in the disproportionate rate of African Americans with heart disease?
Obesity is a big factor, and it's actually now at epidemic proportions, starting now even in children. Because African Americans, we tend to, you know how African Americans eat, and that is, we're eating ourselves to death. And we just like to be full when we leave the table, and we look at the content of what we eat, and we're not very good at exercising. And so by eating all the fat-laden foods and not exercising, it predisposes us to obesity, and obesity is a significant risk factor for heart disease. And it's often missed because, and this is important too, because sometimes if you are very obese, you can exceed the weight limit of most of the testing modalities. And so you may never get the correct test to really determine if you may have a blockage in your heart, because you may not be able to fit on the table. And so some obese people could go through life with disease and just finally dying because they have not been able to get the testing because they exceed the weight limit of the tables or the testing modalities.
One positive and negative of African Americans and obesity is that we are not obsessed with being thin. It's okay, it's more acceptable, which is good for our teenage girls who see these models on TV, who see these actors and actresses, and their symbols of greatness are all these skinny other people. And so it's good that in the African American community, it's okay to have hips.
Sure.
But there's a danger.
Yes.
In that acceptance of being big.
And you know, what you're pointing to is the fact that we may be aiding and abetted by men. because they're saying it's okay. I like fat women, but not realizing that with that obesity comes several other problems that could prevent these women from being there to see their children graduate from college, being there to see them get married, being there to be a part of their grandchildren. So you have to look at it in that sense.
So the women in the household are usually the ones who do the grocery shopping. So we can be the main ones to turn this around.
Absolutely.
We make the menu for the families, for dinner, for what snacks are in the house, for what's in the house overall. So we can turn this around.
Absolutely. We are the head of our tribes. And the grocery shopping, we select the foods, and so even I said it was epidemic in children, starting in the home in terms of the food choices that children get to take to school and that are served at the table. The woman in the home makes that selection, and often children would say, "This is what I want to eat," or "I don't want to eat that." But as a parent and as a mother, knowing the epidemic, I think that they can start making the choices for the family and making healthy choices.
I used to work with a woman who was leading a busy life, and she fed her son McDonald's every night. Chicken nuggets and fries. I don't think he knew how to spell vegetable or what one looked like. So it's important to get the right foods on the table.
Sure. And making sure that the diet is complete, not just with meat or a lot of starch, but it's balanced. There's meat, there's starch, there's vegetables in proportions, and the largest portion really should be the vegetables. And so often the largest portion is the starch, because that's what fills us up. So we tend to eat more of the starch.
Let's talk about exercise and what role exercise has to play in this, because there's a balance. Not only do you need to eat right, you need to get that blood flowing. You need to exercise your muscles. I'm a certified yoga teacher, so I've never had a problem with the exercise. It's the food. I'll exercise all day, but I want to eat.
Making those right choices, huh?
Yes. So it's important to get out there 3 to 5 days a week.
Sure. But exercise means discipline. And the truth is, if you look at most families, we're all on a treadmill. You get up at a certain time. You have to leave the house by a certain time. Or you get to work. You get home from work. It's dinner. It's homework. So it's a vicious cycle. So you have to really make the effort to put that exercise time in. It means you may have to get up a little earlier in the morning or stay up a little later at night to get it in. But I think it's also important to recognize what exercise brings to the table. Let's take, for example, diabetes. Many people don't realize that by exercising, exercise can cause the insulin that your body produces to work better. So it's not just exercising to lose weight, but you also affecting your own physiology when you exercise.
Let's talk about when you should begin getting treated for or getting tested for heart disease. Should it be in your 20s? Should it be in your 30s? Most people tend to wait until there's a crisis.
Sure. But I think what it is, it's important at family get-togethers, Thanksgiving time, have a little conversation about family history. I know traditionally most African Americans don't like to talk about health, so it may be difficult to find out what grandma had, what grandpa had, or even relatives before, because sometimes knowing that can help you to be proactive earlier. Because if you find out that there's a very strong history of high blood pressure, for example, in your family, dating back to great-grandparents, this may be a chance to get started earlier. And that's why now when you take the children to the doctor, they test, they check their blood pressure. But similarly, things like high cholesterol, if there's a strong family history, you could start checking it earlier, because there can also be congenital problems with you producing too much cholesterol that can block. I know of teens having heart attack children having heart attack in their teens because of a congenital problem that produces more cholesterol that can clog those arteries that I talked about earlier.
Now, what's the difference between good cholesterol and bad cholesterol? We hear this a lot, but a lot of people don't know exactly what that means or the importance of cholesterol levels.
Right. The cholesterol, the total cholesterol is made up of several components. You have the good cholesterol or the LDL cholesterol, the bad cholesterol, the good cholesterol, excuse me, which is the HDL cholesterol, the bad cholesterol, which is the LDL, and then you have triglycerides. All those components make up the total cholesterol that you see. The LDL cholesterol, that is the lipid, high lipids or cholesterol that can clog arteries. And so that's why we refer to it as the bad cholesterol, because if you have high levels of LDL cholesterol, that's the type that clogs up arteries. On the other hand, the HDL cholesterol, which has been thought to be more protective. If you have high HDL, it may be protective. But you have people now with low HDL, which is similar to having the bad cholesterol. And the question is always, how can you impact both of those in terms of the cholesterol, the medications that you can take, the medications that can lower the LDL cholesterol, that's the plaque burden that builds up in the arteries. And in terms of the good cholesterol, the best way to increase your good cholesterol is by exercise. And so there again, the exercise component that's affecting our physiology.
What medications are available to help with high blood pressure and cholesterol? I'm sure there's just a ton of medicines
There is a
out
ton
here.
of medicines available to treat high blood pressure, for example. But in treating high blood pressure, very rarely you find someone that just has high blood pressure. You may find someone that has high blood pressure and diabetes, or high blood pressure, let's say, in men that also have prostate problems. And so your choice is based on what else they have going on. Because if you have high blood pressure and diabetes, now we know that there's a certain category of medications that's best for that combination, because it can protect your kidney from the effects of the diabetes later in life. In other words, taking a medicine, the category is called an ACE inhibitor or an ARB, an angiotensin receptor blocker. That category, those two categories can protect your kidneys from the effect of diabetes. So the selection is individualized based on what else they have. For example, a man that has prostate problems, you may choose a blood pressure medications that can help both conditions. So the choice is not always one hat fits all, but it's individualized to what else is going on. For example, someone has high blood pressure that has had a heart attack. There's certain medications that person should be on to prevent them having another heart attack. If you have high blood pressure and your heart doesn't pump very well, for example, there's certain medications in the 2017 that you should be on to try to improve the pump of your heart.
It sounds like knowledge is power with this, that you need to know what you're taking or what's available for you, what's going to work with the other issues you have to make yourself knowledgeable about what's out here and what you have.
Absolutely. And the other part too that we didn't even touch on, which is a whole another category, is the interactions. Because like I said, you may have several different disease processes, and you go to 5 different doctors, and each doctor you go to prescribe you medication for that individual condition. But in your body, you have to make sure that all those medications that you're taking for all those individual problems are not interacting with each other. So that's another whole area.
If you've had a heart attack or stroke, how do you live beyond that? How do you make the rest of your life the best of your life?
That's a great question, because so often people after heart attacks, they could get depressed thinking this is the end. It's not the end, and that's why after heart attacks there are rehab programs, the cardiac rehab programs that are available. And part of that program is not only to build your confidence as you get back to living in terms of exercising and doing all the things that you would like to do, but it also helps your emotional state. Because it's nothing like getting into a room and meeting other people that have been in the same boat with you. And you realize you're not the only person that has had a heart attack and has to go on living. But I think it's not the end, and having a supportive team is critical. And someone there to encourage you and help you realize that, yes, you had a heart attack. These are the things that you have to do. These are the medications that you now have to take, which you probably weren't taking before. But it's important because it can prevent you having another heart attack.
And the message is you can live beyond this, go on to live a prosperous life, go on to live a healthy life after this. Also, it takes recruiting the family as well.
Absolutely. You have to recruit the rest of your tribe, and that's extended family and even children, because I think so often people with heart disease tend to, thinking that they're protecting their children, don't really tell them everything, expose them, because that's helping them too, because they can be more proactive at a young age, one, and secondly, they can be more supportive of their family members too, by helping them and encouraging them along, even in making right choices from here out. You'd be surprised that after a heart attack, children or family members can help you. Oh, are you making the right choice? Should that be is that really what you should be eating? And so all of a sudden...
Do you really need that second honey bun?
That's right. And so all of a sudden, they're all in it with you, and that helps.
And one of the points you made that I want to wrap up the show in making is the fact that you can genetically be predisposed to this, but environment is so incredibly important.
Absolutely. And you can change that environment by making several lifestyle changes. It may mean changing your taste buds, because our taste buds used to the salt, used to the sugar, used to the fat, but just making those changes, and over time I think we'll have a big impact on the epidemic of heart disease, especially in the African American community.
How does your waistline tell? How does your waistline give a clue into whether you're more prone to having heart issues?
Well, there's something called metabolic syndrome, and metabolic syndrome encompasses your waist, your cholesterol, your blood pressure. And so people that have increased waistline, both men and women, are at increased risk for heart disease.
So is there a particular size that your waist needs to be? And what about the people who say, and I've said this myself, where those scales don't really reflect
Yes,
certain groups?
Because the thing about it is your weight, your body mass index, as it were, is also related to your height. And so sometimes we don't take that into consideration if you're tall or if you're short. But the bottom line is that's why we use your BMI, body mass index, when we talk about obesity, because it takes that into consideration. And once it's over 25, you are obese.
Well, and then there's, of course,
morbidly obese, and where you have to think in terms of surgical or other interventions to intervene.
So wrapping this up, you need to be mindful of staying active.
Staying active, number one. Number two, you need to know your numbers. What's your blood pressure? What's your cholesterol? What's your good cholesterol? What's your bad cholesterol? What's your weight? All these things, it's important to know. If someone calls you at 2 a.m. in the morning, you should know your numbers and know what numbers you need to be working on. Are you overweight? Is your blood pressure consistently where it should be? Are you exercising? It's absolutely important to know your numbers and just be aware. Heart disease is the leading cause of heart disease among both men and women, but those statistics can change. if we take control and be more proactive.
And take those symptoms seriously. Like
Absolutely.
that was really interesting what you were saying about someone who says, oh, I've been tired for years now. I've been suffering from this just severe exhaustion, and nobody pays attention to it.
And the other thing about women in particular is that we may have these symptoms and we'll say, oh, we'll wait until tomorrow. And so I often use the example, if a woman is having chest pain, she first has to call her girlfriend, her mother. She has to call the pet keeper. She has to call the babysitter. She has so many people to call before she seeks help. Whereas if it's a male, he's in the emergency room within 5 minutes. That means by the time the woman arrives, after calling and informing all these people, it's late. So we're often late, and that's why the effect, we are twice as likely to die from a heart attack as a man, because we present too late and our disease process is far gone. And so the other thing that I would say to women is be more in tune, number one. Yes, we are so used to be multitaskers, but sometimes it's important to put ourselves first.
Exactly. Well, we are going to have a part 2 of this show. We're going to come back and we're going to discuss how sleep affects your heart. And most people don't know that if you're not sleeping well, if you've got some sleep issues, you can also be more at risk of having a heart attack, but we'll talk about that coming up. You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. We've been talking to Dr. Barbara Hutchinson. She's a cardiologist with the Anne Arundel Medical Center, and she's also the president of the Association of Black Cardiologists. And we'll talk about the fact that you're also one of the few people in Maryland who's certified in sleep. Who's certified in sleep. That sounds good to me. Thank you so much and have a great day. I'm Stephanie Gaines-Bryant.